Hi everyone, and thank you for taking the time out to view my practicum presentation. My name is Mira, and I'm excited to share the project that I completed during my practicum experience. This presentation will walk through the need for the project, the goals, implementation process, outcomes, and the leadership skills I gained along the way. So my practicum was completed at Hackensack Meridian Health within the Shore Care Division, which provides internal travel nursing staff support across multiple hospital sites. Shore Care serves as an in-house staffing resource as well that fills temporary gaps while maintaining system-wide standards of care. I worked closely with the education, nursing leadership teams to identify a project that would enhance onboarding and promote consistency across the different units as well. So the need for this project became clear through the feedback from internal travel nurses and the unit managers. Also, during the monthly meetings, we noticed that there were a lot of questions that were not being answered. Even though these questions and answers were discussed during orientation, there was a repetition of those questions. So we understood that there was a hard time having the information being retained. So we wanted to come up with a solution for that as well. Many staff expressed confusion when starting a new assignment due to the lack of standardized onboarding material. While some units had strong orientation systems, others had very little, and also some were acute care units, so they required different types of training as well. While the inconsistency impacted confidence and predictivity in the first few shifts as well. A needs assessment confirmed the gap in the structure. Easily accessible educational resources were needed for these nurses. Leadership also noticed delays in the workflow, understanding, and increased questions, like I said, during the first few weeks of the assignment as well, highlighting the need for a unified onboarding solution. The project that we developed was created and launched with a virtual classroom using Google Classroom for internal travel nurses. The goal basically here was to provide centralized, consistent platform where nurses could access onboarding materials, site-specific resources, policies, and educational content at their own pace. Google Classroom was selected because it had a low cost, accessibility, and it was very user-friendly, even when they were on site as well. The main goal of this project was to increase onboarding consistency across the hospital units. Another goal was to improve nurse confidence and readiness, reduce orientation-related questions as well, and promote engagement with available resources by providing, all internal travel nurses with the access to the same virtual classroom. We hope to standardize and the experience, improve their experience throughout the networks as well, reduce variability in initial shift performance. Although the project is still in its early stages, the outcome so far has been very promising. Staff who used the classroom during onboarding reported feeling more prepared and appreciated having 24/7 access to the material. Supervisors also noticed fewer basic orientation questions and a smoother transition during the first week. Based on early feedback surveys and follow-up interviews, the virtual classroom is improving their clarity and easing the learning curve for floating nurses across the system as well. The project was very well received by stakeholders as well. Unit educators, managers expressed appreciation for having a single place to direct new staff for their resources. HR and education teams supported the implementation as well, and leadership valued the potential cost savings through improved onboarding, efficiency, and reduced delays. Internal travel nurses provided positive feedback about the convenience of accessing materials before and during their assignments. This project is designed to be sustainable. Google Classroom is free to use unless upgraded, and the only costs involved were the time spent creating the content. The virtual classroom can be updated regularly by the education team as policies and workflows change as well. Feedback will be gathered through quarterly surveys, and the usage trends will be monitored to make improvements. The classroom now serves as a living resource that continues to evolve with the staff needs. For this practicum, I set the goal of improving my leadership and project management skills, especially in the area of nurse education and onboarding. I also wanted to strengthen my communication and collaboration with interprofessional teams. I focused on including communication and relationship building, knowledge of the healthcare environment, and business skills like project planning and evaluation. Working on this project helped me grow in each of these areas and boosted my confidence in leading a real world initiative. Through this project, I learned how important it is to involve staff early, listening to feedback, and building something that truly meets their day to day needs. I also saw how thoughtful planning and consistent follow up can lead to a sustainable change. Most importantly, I learned that strong leadership doesn't always come from being the loudest voice. It comes from being organized, responsive, and open to improvement as well. Thank you again for watching my presentation. I've listed my references below. I can't wait to see the rest of your presentations as well. Thank you again. Bye.